Today, it is one of the most common health conditions in the world. Millions of people are living with diabetes, and many more are at risk of developing it. Almost every family has someone who is dealing with this condition. People take medicines, do regular blood tests, and try different treatments just to keep their blood sugar under control. But an important question still remains. What exactly is diabetes? What is happening inside the body that causes blood sugar to increase? And why is this condition becoming so common today? In this video, we are going to explain diabetes step by step in a simple and clear way. So let's understand what really happens inside the body. You're watching Health Decodes. Before we understand diabetes clearly, first we need to learn about the key organ that controls all of this. That organ is called the pancreas. The pancreas is an organ located behind the stomach, near the small intestine. Even though it is a small organ, it plays a very important role inside our body. In fact, the pancreas has two main functions. The first function is to control the sugar level in our blood, and the second function is to help in digestion. But today, we are going to focus only on the first function, controlling blood sugar. So how does the pancreas control blood sugar? It does this by releasing certain hormones directly into the bloodstream. The first hormone is insulin. Insulin has a very important job. It lowers the blood sugar level when it becomes too high. The second hormone is glucagon. Glucagon does the exact opposite. It increases the blood sugar level when it becomes too low. In this way, these two hormones work together like a perfect balancing system inside our body. Both insulin and glucagon are produced in a special group of cells in the pancreas called the islets of Langerhans. Even though this part is very small, it plays a huge role in controlling blood sugar levels. This is also the place where the story of diabetes begins. Diabetes occurs when there is a problem with insulin. Either the body does not produce enough insulin, or the insulin that is produced does not work properly. When this happens, the sugar level in the blood starts to increase, which leads to diabetes. Now, you might have a question. We know that insulin lowers blood sugar levels, but why does the body also produce another hormone, glucagon, that increases blood sugar? At first, this may sound confusing. But to understand this clearly, we first need to understand what sugar actually is and why our body needs it. Sugar, or glucose, is not just something sweet that we eat. It is actually a very important source of energy for our body. Glucose is a type of carbohydrate that acts as fuel for almost every cell in the body. Our brain needs glucose to think and function properly. Our muscles need it to move and work, and every organ in the body depends on it to carry out its daily activities. In simple terms, sugar acts like fuel for our body, just like petrol helps a car run. Let's now see how this process normally happens inside the body. When we eat foods that contain carbohydrates, such as rice, bread, or fruits, the digestive system breaks them down into glucose. This glucose then enters the bloodstream, which causes the blood sugar level to rise. When the pancreas senses this increase in blood sugar, it releases the hormone insulin into the bloodstream. Insulin acts like a key that helps glucose move from the blood into the body's cells. Once inside the cells, glucose is used to produce energy that the body needs for all its functions. Because of this process, the level of sugar in the blood gradually decreases and stays within a healthy range. But the body must also be prepared for the opposite situation. Sometimes, blood sugar levels can drop too low. This can happen if a person has not eaten for a long time, has done heavy physical activity, or if too much insulin is present in the body. When blood sugar becomes too low, the body begins to lose its main source of energy. The brain is the first organ to be affected because it depends almost completely on glucose for energy. As a result, a person may start to feel symptoms such as dizziness, weakness, confusion, sweating, or difficulty concentrating. In more serious situations, very low blood sugar can lead to blurred vision, fainting, or even loss of consciousness. This condition is called hypoglycemia, and it can become a medical emergency if it is not treated quickly. To protect the body from this dangerous situation, another hormone comes into action, glucagon. When blood sugar levels fall, the pancreas senses this change and releases glucagon into the bloodstream. Glucagon then travels through the blood to the liver, an organ that plays a very important role in storing energy. The liver stores glucose in the form of a substance called glycogen. When glucagon reaches the liver cells, known as hepatocytes, it signals them to break down glycogen into glucose and release it back into the bloodstream. This increases the blood sugar level and helps provide energy to the brain and other organs. In this way, insulin and glucagon work together like a perfectly balanced system. Insulin helps lower blood sugar when it becomes too high, while glucagon raises blood sugar when it becomes too low. Because of this careful balance, the body is able to maintain a stable supply of energy throughout the day. When blood sugar levels drop, our body instantly releases a hormone called glucagon. This hormone travels through the bloodstream to the liver, which acts like the body's personal energy bank. The liver receives the signal and begins to work immediately. Inside the liver, extra sugar has been safely stored in the form of glycogen. As soon as glucagon arrives, that stored glycogen is broken down into glucose and released back into the blood. Blood sugar levels rise again, and the body receives the energy it needs to continue functioning normally. We rarely notice this process, yet it is happening quietly every day to keep us alive and balanced. In simple words, the liver works like a savings bank. When sugar is available in excess, it stores it. When the body needs energy, it gives it back. This beautiful teamwork between insulin and glucagon keeps our energy steady throughout the day, often without us realizing how hard our body is working for us. Now let's talk about something deeply important: diabetes. Many people believe diabetes appears suddenly, but the truth is different. It usually develops slowly over time. Diabetes is a long-term condition caused by problems in the way the body manages blood sugar, especially involving insulin. There are different forms of diabetes, but the main types are type 1 diabetes, type 2 diabetes, prediabetes, and gestational diabetes. Type 1 diabetes happens when the body can no longer produce insulin. This occurs because the immune system mistakenly attacks the insulin-producing cells in the pancreas. Without insulin, glucose cannot enter the body's cells, so it remains trapped in the bloodstream. This leads to high blood sugar levels. It is often seen in children and young adults. Common symptoms include excessive thirst, frequent urination, sudden weight loss, and constant tiredness. For people with type 1 diabetes, insulin is not optional, it is essential for life. Type 2 diabetes is more common and is strongly connected to lifestyle factors. In this condition, the body still makes insulin, but the cells stop responding properly. As a result, glucose remains in the blood instead of entering the cells where it is needed. The body tries to solve the problem by producing more insulin. The pancreas works harder and harder, trying to keep blood sugar under control. But over time, it becomes exhausted. Eventually, it cannot keep up, and blood sugar levels stay high. Daily habits play a major role in this process. Frequent sugary foods, unhealthy eating patterns, lack of exercise, stress, poor sleep, and too much sitting can increase the risk. But there is hope. Movement can be powerful medicine. When we walk, exercise, or stay active, our muscles use glucose for energy and become more sensitive to insulin. The good news is that the early stages of type 2 diabetes can often be improved. With healthier food choices, regular exercise, weight management, and proper medical guidance, blood sugar levels can become much better. In some early cases, it may even be reversed. The third type of diabetes is gestational diabetes, also called GDM. It develops during pregnancy, usually between 24 to 28 weeks, even in women who didn't have diabetes before. Why does it happen? During pregnancy, the placenta produces hormones to support the baby. But one hormone, HPL, reduces how well insulin works. This causes insulin resistance, so the body needs more insulin, and if it can't produce enough, blood sugar levels rise. Some women have a higher risk, especially if they are overweight, have PCOS, follow an inactive lifestyle, or have unhealthy eating habits. If not managed properly, it can cause problems. The baby may grow too large, delivery can become difficult, and after birth the baby may face low blood sugar or breathing issues. In the long term, the child may also have a higher risk of obesity or type 2 diabetes. But the good news is, it can be managed. Healthy diet, regular physical activity, and proper medical care make a big difference. Eating more fiber-rich foods, avoiding excess sugar, and even simple walking daily can help control blood sugar. Most importantly, regular checkups and early screening are key. With proper care, both mother and baby can stay safe and healthy. The fourth condition is called prediabetes. This is a stage where blood sugar levels are higher than normal, but not yet high enough to be diagnosed as diabetes. In this condition, the body still produces insulin, but the body's cells do not respond to it properly. Because of this insulin resistance, glucose cannot easily enter the cells and instead stays in the bloodstream, causing blood sugar levels to rise. Prediabetes is mainly caused by lifestyle factors such as unhealthy eating habits, overeating, lack of physical activity, being overweight, and long hours of sitting without body movement. The good news is that this stage is often reversible. With regular exercise, proper diet, weight control, and periodic medical checkups, blood sugar levels can return to normal. If ignored, prediabetes can gradually progress to type 2 diabetes over time. That is why doctors call it a warning signal from the body. Now, we have discussed the different types of diabetes and how they affect the body. But an important question still remains: how do we confirm whether someone actually has diabetes? The answer is simple: through a blood test. Doctors measure the level of glucose in the blood to understand whether it is within the normal range or not. Based on that, it falls into 3 stages: normal, high blood sugar, and low blood sugar. There are 2 common tests. First is fasting blood sugar, taken after 8 hours without food. Range is around 70 to 99 milligram per deciliter. Second is post-meal sugar, checked 2 hours after eating. Normally it should be below 140 milligram per deciliter. So these numbers help doctors understand your condition clearly. Then okay friends, now we come to the end of this video. Today we learned what sugar is, how it works in the body, how insulin and glucagon maintain balance, and the different types of diabetes. I hope this made things simple and clear for you. If you like simple, science-based health content, stay tuned to Health Decodes. Take care of your health, stay aware, and I'll see you in the next video.